Good morning. Welcome everyone to our Center of Nursing Excellence here at the Southern Virginia Higher Education Center. My name is Kimberly Throckmorton. I'm the manager here. I've been here for about 3 years, so we do a little bit of everything here, healthcare, training. We have partners that we partner with to offer a certified nurse aid program, phlebotomy. We also have licensed practical nursing and associate degree nursing. And then our college partners offer our nurse practitioner and our education beyond the registered nurse. We also have an EMT program here. We also offer community training for CPR as well as for healthcare professionals. So we'll get started on our tour and show you our space. Come on back. As you see on the screen, we have video footage showing. We come in here with our students to give them a little bit of education prior to them starting the simulation. We make sure that they have their patient information, their medications that they need, and we also provide a little bit of lecture about what they're going to be doing today, so they have a little heads up and a little knowledge of what they're doing. We do record all of our simulations for our nursing programs as mandated by the Board of Nursing, but we also offer that feature to anybody that's coming in for training if they'd like to have their session recorded. The one benefit of that is if you're part of our training, we give you access to the video so that our students can see what they did well or what they may need to improve on. So sometimes we need to see the good so we can build confidence, but we also can learn from others so they can go back and see what someone did well and kind of mimic that and learn from that, or they can see maybe what someone did not so well and they could learn from that as well. We do break our simulations up into phases, so after each phase, we do about 3 typically. We bring everyone back in and we ask them to talk about what do we do good, what do we need to improve on, but also what are the things that maybe we missed, what are some safety issues, what are some communication breakdowns that we had. So debriefing is just as important as that hands-on, it's that critical thinking time so that they can reflect. So I will bring you on into our simulation room. The first thing we have here, as you see, we have a birthing mom. She is Sim Mom. We use Laerdal products here. We can actually birth the baby in a bunch of different ways. We can have normal delivery, we can have an abnormal delivery, we can have issues after she delivers. She is able to be loaded multiple times. We also can have, she can get medicines administered just like a regular person would. The students can give injections, they can give IV medications, they can put tubes in. Anything that you think realistically could happen to someone you know, we try to make it realistic and mimic it here so they get that hands-on practice here before they enter into a real-life human. So you also see we have this gentleman here. If you come a little closer, you can see that he is actually sweating. So he is really advanced, so we can have him sweat. He cries. His pupils are reactive to light, just like a regular human. He also is anatomically correct, so if we needed to put an airway in to give him a way to breathe, we could. We could put a trach in, and as you see, he's shaking, so he's actually having a seizure right now. We can put a catheter in for urine if necessary. We can start IVs on him. We also can do CPR. With CPR, he has feedback, so we can make sure we're giving good quality CPR, because we know if we're not giving good quality CPR, it's ineffective. So we can see, are they doing it fast enough? Are they going deep enough? So he has a lot of features. He is trauma-based, so a lot of our EMTs or our trauma folks can come in here and practice those skills if they wanted to. We don't just offer to students for training, we also offer healthcare professionals if they need to do some professional development or continuing ed. If they let us know what they want, we can build the simulation for them, or sometimes they say, I want to run it, but I want to use your equipment, so we also offer that as well. So it's not a lot of places around that have these items, so these are great items to get your hands on, to get that practice and get that confidence and feel comfortable before you enter onto a real patient. So that's what we're really trying to do here, is provide a safe learning environment so folks get the confidence and they get the skills necessary to be good quality educators and professionals when they're doing it. We have the patient monitor, but we may change something on the screen. See if they pick up on that their patient is declining or their patient's got to change, and see where they need to go with that. They also have a medication dispensing unit, and they also have a charting system that they bring at the bedside to chart. So this is our control room. As you can see, we've got monitors where we are watching what the students are doing. We also control all of the mannequins or the simulated patients from in here. We adjust their vitals. We may make them cough. We also have someone that is the voice so that they can interact with the students. So if the student asks them a question, we answer it in real time so that they're having that patient interaction. We also have family members and other interdisciplinary professionals coming in so that they have to learn that as well. So we can see in and see what they're doing. Our cameras, if we want to scan in to see what dose they're given on a syringe, we can zoom in and see it. Make sure they're given the right dosage. All right, so this is Nursing Ann, and kind of like her name, she is a nursing skill simulator. So anything you can think of for nursing, we try to make sure that we do with her. We could put feeding tubes in. We could put central lines in. We could also catheterize her. But she also, if you look, she's very realistic. We want to make sure we're very realistic in what we're giving these students so that they treat it as so. So you'll look and see she actually has age spots, and she's very realistic all the way down, and even her features, so that they get that understanding that they need to treat it as such. And then if you come over here, we've got little one. So this is our 1-year-old. As you can see, kind of moving. We can control these with sim pads, which are kind of like an iPad. So we also have the ability to make sure that we're checking a full assessment. So we can enlarge the liver if we need to see if they catch that when they're doing their assessment. We also can enlarge the fontanelles to see if they pick that up. Baby can have a seizure. We can drop the oxygen level and the baby will turn blue around its mouth, see if they pick up that we've got some oxygenation issues. And we can administer meds just like we do with any baby, any route you can think of. And this little one is also anatomically correct, so we could put an airway in if we needed to. So this space is our skills lab. So it looks like a skilled nursing setting. It also may look like a nursing home or an assisted living setting. And here's where they do their basic skills and get their training so that they master them here. And then they bring them to their simulations in there for the more robust simulations. And we do simulations on all disease processes, and as you can see, we have the whole lifespan. So we have itty-bitty babies all the way up to geriatric. So we try to make sure it's realistic, giving them things that they're going to encounter. So COPD, grief and loss. We also do organ failure, and they've got to take care of that. So we make sure we give them the training of things that they're going to see when they're in their real life settings. So they come in here and they'll get basic settings like starting an IV, learning how to properly bathe the patient, making sure they're making the bed properly. We can do blood pressures, feeding tubes, all of those things that we want to master before we take them to the simulation. Simulation is where they're trying to carry out as close to clinical as possible. So we want them to really master it here and then bring it in there with us. All right, and this is our last space. This is the classroom. So everybody kind of starts out in here. They'll get their information for the day, and they'll go back and forth between the skills lab. They may do some studying and reading here. The teacher may give them some guidelines, and then they go into the skills lab and they carry them out.